All right, so this is your stress part 2. We're going to continue with that normal function, with that psychological responses to stress. We've got that anxiety. It could be nervousness, dread. We've got the generalized anxiety disorder and the post-traumatic stress disorder. So GAD is characterized by the unrealistic levels of worry and tension. Post-traumatic stress disorder is that serious mental health condition that they may have flashbacks, behaviors that result from exposure. We might also see anger, depression. And then when we start to look at the altered structure, it's the body's ability to respond to infections. It is negatively altered by that stress. And so high stress levels exacerbate other illnesses, especially your autoimmune, MS, and some viruses. And then we start to have the hormonal altered responses. And I told you about the cortisol levels. Really, all of that, it can really impact an individual and how they lose weight, how they just really their overall health. We can see a delay in ovulation and suppress menses in females, and we can have organ failure. So diversity considerations. We know that everybody is unique, and so we need to really think about like how does like your children versus adults versus older adults, and then the beliefs and culture really affect stress and our abilities to be resilient and respond to it. On that assessment, you guys should be going through this with 202. So this is pretty, I'm not going to spend a lot of time on this, but using those open-ended questions, we want to truly try to identify the ability of the patients to problem solve. We want to help them so individualize and tailor coping strategies, the cultural competence, and then we want to address both physical and psychological manifestations. And then remember that what's one person's stress may not be another person's stress. Safe practice alert. We have to ask our patients if they feel like harming themselves or others. And if they say yes, we need to say, do you have a plan? We can never leave a patient alone or with items that they may be able to harm themselves if they say yes to that. So some of our nursing diagnoses, now we've talked about the nursing process, some that could relate to stress are ineffective coping, anxiety, that readiness for enhanced coping, and stress overload are all NANDA approved nursing diagnoses. With the planning, the patient will, remember, the patient will. So really it goes hand in hand with whatever your nursing diagnosis is that you selected. You might want them to discuss possible coping strategies, just reporting the increased ability to concentrate. Maybe they'll have respite care, especially if we have the caregiver role strain, support groups, and other strategies for coping for maybe family violence, right? Collaboration is huge. You want your social worker involved right away to help you. You might need a dietitian, maybe pastoral care, maybe family members. I would really evaluate that and make sure that that's appropriate. Case manager, psychologist, psychiatrists, and then maybe even your advanced practice nurses, so your nurse practitioners. That implementation. So really what we need to think about as nurses is we really want to focus on trying to decrease the stressor. And so that's what I said on the delegation, or not delegation, but collaboration. I said family members, but you really need to make a good assessment and judgment on that and hopefully determine if they're the stressors, like maybe they need to get out of the room. And then really the interventions need to be agreed on by the patient and the nurse. This can't just be the nurse saying this is what we're going to do. The patient has to agree and say that that's going to work. Always acknowledge an individual's feelings and with the stressors, and really try to help mobilize support. And then there's other, general strategies that we can do with that implementation. Stress management, maybe just focusing on balance, relaxation, nutrition, Maybe it's time management and development of skills. They might maybe need to do some anger management, maybe nutritional support, other support groups. And then CAM. So what are some complementary therapies? Relaxation therapies, exercise, sleep, guided imagery, meditation, mindfulness. Yoga is huge. Biofeedback, that energy therapy, so Reiki and therapeutic touch, and maybe even some Eastern medicine. Remember, evidence-based practice. Why do we do it? There is an effective alternative stress reduction modalities. So really the progressive relaxation and guided imagery have been shown to significantly reduce pain, improve scores on anxiety and stress scales, and promote sleep. We know if we're stressed, we don't sleep very well. We might wake up in the middle of the night, or we can't fall asleep because our minds are racing and we just can't shut them down. Those are problems. There are many studies that have indicated that progressive relaxation is effective, and it can help to treat nausea and vomiting, pain, depression, anxiety, sleep disturbance, you name it. We may have to intervene with a crisis intervention. We may have to do a temporary hold and admit the patients. You can't admit patients against their will unless they're a harm to themselves or others. But we can call the crisis team in if we have it, or 1-800 numbers. And then really, the end of the day, we really need to help give these patients tools so that they can implement strategies on their own. Evaluation, it really depends on what your stated goal was, but really just things to think about. Stress in nursing. So it is stressful. Nursing is stressful. I'd love to say it's not, but it's stressful. And it can lead to depression, compassion fatigue, burnout, decreased job satisfaction. And really, this is the most important thing, is that in order to care for others, we have to care for ourselves. We have to make sure that our tanks are full, and we have to take care of ourselves. And so exercise, nutrition, mindfulness, things we need to also practice. All right, and that is the end of your stress part 2.